Hello everyone, welcome to Medicuisine. Today we are going to talk about counseling of Parkinson disease patients. So today's topic of discussion is counseling of Parkinson disease patients. This is our third video regarding the Parkinson disease, and the first video we have discussed about Parkinson disease in details. And the second video we talked about the Parkinson plus syndromes, and today we will talk about the counseling of Parkinson disease patients, how we actually counsel these patients, especially at the time of diagnosis, and to minimize the risks of morbidity and mortality. So the counseling of Parkinson disease patients can be divided into three parts. Part 1, reassuring and motivating the patient, which is done at the time of diagnosis. Counseling regarding psychiatric problems. As you know, majority of Parkinson disease patients have psychiatric problems like depression, psychosis. So we will counsel these patients regarding these psychiatric problems as well. And in the last, we will talk about how to actually counsel the Parkinson disease patients regarding minimizing the risk of morbidity and mortality, like the risk of falls, which leads to injury-related deaths, and the risk of aspiration pneumonia. So, as you know, general medicine is not only about giving medicines to patients. In fact, it deals with the oral management of the patient, in which the counseling has got an integral part. So, regarding the counseling of Parkinson disease patients, the first thing we will do is reassuring and motivating the patient. The reassurance is done especially at the time of diagnosis. So this reassuring and motivation part is done at the time of diagnosis actually. At the time of diagnosis. You know, most people assume Parkinson disease to be a notorious villain, and they think that this is a deadly disease. Most of the patients, when they are first diagnosed with Parkinson disease, they think they have been given death sentence. So by proper discussion with the patient regarding the nature of the disease, the course of the disease, you can assure the patient that they can actually lead a quite normal life if they take care of themselves, they take medicines regularly, they do regular exercises. The motivation of the patient should be practiced every time the patient meets with you. Moving on to the second part of counseling, which is regarding the psychiatric problems. As you know, majority of the Parkinson disease patients have psychiatric problems like depression, psychosis, and an estimate shows that about 20 to 40% of these patients have psychiatric problems. So a quite normal thing for Parkinson disease patients. So special counseling should be done regarding these psychiatric problems, and if a specialty consultation is required, refer them to a psychiatric specialist actually. Apart from counseling regarding these psychiatric problems, the actual treatment of these psychiatric problems, especially psychosis, is very difficult in Parkinson disease patients, and they poses a great challenge for the physicians, because the antipsychotics available in the market to treat psychosis, they actually are shown to worsen the symptoms of Parkinson disease. So great attention should be paid while treating psychosis in Parkinson disease patients, because the drugs, the medicines which are normally used to treat psychosis, they are shown to worsen the symptoms of Parkinson disease. So here is a favorite question for examiners to ask, that what are the drugs, what are the medicines that are used to treat psychosis and Parkinson disease patients? So this is the favorite question for examiners. So there are two drugs available to treat psychosis and Parkinson disease patients, because they have less effect on the motor symptoms of Parkinson disease. These two drugs, clozapine and quetiapine, can be used safely for the psychosis and Parkinson's disease patients, because all the other antipsychotics, they're shown to worsen the motor symptoms of Parkinson's disease. Now we are into the third part of counseling, which is regarding minimizing risks. So a question arises: what are the most common causes of death in Parkinson's disease patients? There are two most common causes of death. One is aspiration pneumonia. The second one is falls, which lead to injury-related deaths. So to minimize the risk of falls and to minimize the risk of aspiration, special counseling should be done of the patients. So to minimize the risk of aspiration pneumonia, you can actually counsel the patients regarding oral hygiene, the vocal cord strengthening exercises, and the last stages of the disease, special feeding tubes are inserted to minimize the risk of aspiration pneumonia. These tubes are called PEG tubes, the percutaneous endoscopic gastrostomy tubes, or simply G tubes. So these are the feeding tubes that can be used in Parkinson's disease patients, especially in the later stages of the disease and the last stages of the disease, to minimize the risk of aspiration pneumonia. And regarding minimizing risk of falls, which lead to injury-related deaths, you can counsel the patient regarding avoiding stairs and using special grip slippers and boots to wear to minimize the risk of slippage actually, and you can counsel the caregivers to lighten the house in a proper way to minimize the risk of falls actually. So this was something about counseling the Parkinson's disease patients. I hope you understand the topic very well, and if you have any question, you can comment it down.